Hello everyone, welcome to sqadia.com. My name is Saima Mushtaq and our today's topic is non-allergic rhinitis and nasal polypi. We will cover this lecture in 4 sections. In the first section, we will discuss the vasomotor rhinitis and how the vasomotor rhinitis develop, pathogenesis, and how it present. What are the signs and symptoms of vasomotor rhinitis, and then how we treat vasomotor rhinitis. Then after vasomotor rhinitis, we will talk about some other forms of rhinitis, non-allergic. We already talked about allergic rhinitis in detail in our previous lectures. So today we will talk mainly about the non-allergic rhinitis. And in the second section, we will talk about the rhinitis which is induced by some drugs. And then what's rhinitis medicamentosa. And then we will also talk about the rhinitis of pregnancy, honeymoon, and emotional rhinitis. And then what's gustatory rhinitis and non-airflow rhinitis. So all these are different types of non-allergic rhinitis. Allergy is not involved in this, and allergic rhinitis, as we discussed, is due to antigen-antibody reaction when the allergens enter the body, and the response to that allergens or antigens cause allergic rhinitis. This is different, it's non-allergic rhinitis. Then in the third section, we will talk about the ethmoidal polyps and how they develop, what's the pathogenesis of ethmoidal polyps, bilateral, what are the signs and symptoms, how they present, and what's the management of ethmoidal polyps. Then in the fourth and final section of our lecture, we will discuss antrochoanal polyps and what's the location of antrochoanal polyps, how they form, how they present, what are the signs and symptoms, what are the different things from which they should be differentiated. That's covered under differential diagnosis, and what's the treatment of antrochoanal polyps. So all this will be discussed in our today's lecture topic, non-allergic rhinitis and different nasal polyps. So to learn about this topic, keep watching sqadia.com.